Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, so it is quite convenient for the study. Please make use of it. Anyway, my dear friends, we have been discussing about vaccination, and today we will see another important case related to vaccination, so which we commonly encounter in our OPD practices. See here, a parent will come to you, the parents who have taken the quadrivalent HPV, a human papilloma virus vaccine. I think everybody knows about this. Want to know that whether they have to take the monovalent vaccine which is newly arrived in the market. Mother who is 37 years of age wants to know if she can also take that vaccine. Now the question is, here it is not related to the child. Of course, to an adolescent girl we have to go for HPV vaccine, so human papilloma virus vaccine. This has to be given especially for the adolescent girl because of risk of development, of possibility of development of uterine cancer, cervical cancer. Okay, HPV virus is one of the most important precipitating factor or triggering factor for this particular cervical cancer. That means if you vaccinate your child against HPV, so you can prevent, or risk factor can be reduced with regard to the uterine or cervical cancers. So with this intention, this vaccine has been given to the adolescent girl. Now here, this mother in her adolescence already taken the HPV vaccine, but she has taken quadrivalent HPV vaccine. Quadrivalent HPV vaccine. Nowadays, in the market, we have got a monovalent vaccine which is available. Okay, now her question is, she already taken the quadrivalent vaccine previously when she was adolescent, but now whether she has to take this vaccine, newly arrived monovalent vaccine also, to make herself safe. This is the question. Now, the answer is HPV, human papilloma virus vaccine, is previously available in one form, that is quadrivalent vaccine. Basically, it is a quadri means 4. So basically, it is quadrivalent vaccine. That means this particular quadrivalent vaccine is effective against 4 important strains of HPV virus. Okay, strain number 16, 18, 6 and as well as 11. And the efficacy rate is about 90 to 100%. Quadrivalent vaccine. Okay. Monovalent vaccine which is available now in the market, okay, this is effective against 6, 11, 16, 18, 31, 33, 45, 52 and 58 strains of the HPV virus. These are the strain numbers. That means 1, 2, 3, 4, 5, 6, 7, 8, 9. So about the 9 strains of the HPV virus you can get that means safety against these 9 strains. Whereas in quadrivalent you are getting only 4 strains. You are immunized against only 4 strains of HPV vaccine. Therefore, this is giving a wider range of protection, isn't it? Monovalent. But of all the types of the HPV vaccine, if you see 16 and 19, we contribute about 70%. Okay. Of course, there are so many strains identified, but out of them, 16 and 19 will contribute about 70%, whereas 31 strain, 33 strain and 45th strain, that contribute for only 5%. Only 5%. And overall, the monovalent covers about 84%. Overall coverage of the monovalent is about 84%. Now, in this case, this particular lady who is already vaccinated by the quadrivalent vaccine during her adolescence, it was actually not recommended to revaccinate her again. Why? Because the chance of infection with any one of the 5 additional HPV types and developing a disease or the cancer is low. When you look into the prevalence rate, she is already vaccinated against 16, 18, 6 and 11. Only thing is, monovalent vaccine has got some, will offer protection against some of the more strains. But what is the question is, at this stage, 37 years, if that lady is in the adolescent stage now, definitely monovalent vaccine would have been prescribed to her. But now she is 37 years old. At this stage, At this stage, the chance of developing the cancer or the disease from these left out strains like 31, 33, 52, 58, etc. is very, very low. So therefore actually, so this particular lady, it is not indicated. Now one more important thing is higher rates of injection site swelling or abscess and redness is also seen in revaccination individuals when compared to the older other individuals. Okay, the chance of injection abscess is also very high when you revaccinate again in such cases. Monovalent or 9V HPV will elicit a memory response to HPV 6, 11, 16 and 18 and a marked response to HPV 31, 33, 45, 52 and 58. So in this girl, or not girl, actually in this lady, there is no need to go for the another vaccine. After 30 years, the benefits of HPV virus vaccine in women to prevent the risk of the cancer is very, very low. This is very important. The woman is already 37 years old. Now if you see 30 years ke baad, after 30 years if you are giving HPV vaccination, then the risk of cancer is very, very, although you vaccinate in the later part, if you vaccinate, although the chance of offering protection against the cancer is low, you should vaccinate in the earlier part only, in the adolescence age only. Okay, later, because 37 years old means almost all she is in the peak and completion of her reproductive age. Okay, so therefore the chance of this is very low now. Now it should be given before that. Okay, it should be given before that. Maximum HPV infection occur before 30 years. HPV infection जो आता है वो before 30 years है. So this is lady is already 37 years old. So once it occurs, then there is no role of the vaccine. Okay. So this is about this HPV vaccine. So thank you very much. We will meet in another class. But don't forget to subscribe to my channel and also please give your valuable comments. Thank you very much.